Presley was diagnosed with a rare form of brain cancer called ATRT at just 5 months old, and she would later be in the hospital for about 2 years.
Hi, my name is Liz Knox, and I am Presley's mom. Since Presley being diagnosed with brain cancer at 5 months old has impacted this family in many positive ways, but also in some ways that might limit things that we can do. In the beginning, when Presley had just come home from the hospital, we couldn't go out and do things. We kind of had to keep her here because of her immune system. But as she's grown over the years and become the most amazing little girl, it still affects our home life, but we're able to do more things. Obviously, she has a schedule. We've got to follow that schedule with medications and feeding. She's fed by G-tube. In 2016, May, she had 2 brain resections that were over 7 hours each, 4 days apart, to remove 90% of the brain tumor she had. And then after that, she had 13 weeks of chemotherapy that actually made her very, very sick, and she had to be intubated a few times because she got mold in her lungs and different things. In the meantime, she got a G-tube put in so she could be fed that way. She also had a Broviac put in, which was all for medications her chemotherapy would go through. And then she also got 2 bone marrow transplants back to back in September and November. Actually, October, sorry. And it was her own bone marrow because that was not affected by her cancer. So it was an auto bone marrow transplant, but they were back to back. And the days leading up to the bone marrow transplant, you have to do 5 days of 24-hour, very intense chemotherapy where she actually could not wear any clothes except for like a t-shirt. They actually wrapped her Broviac instead of putting tape on her with like gauze, because every 2 to 4 hours she'd have to get a shower because the chemotherapy was so strong that it would burn her skin. He did that 5 days before the bone marrow transplant, and then she'd have a bone marrow transplant and her immune system would be 0, and it would take about 3 to 5 days to build back up. After that, being in the hospital 1 year, she came home, and she was only home about a couple days when she could not control the fluid in her brain like we can. Think of going on an airplane and it's not pressurized or your ears pop. That's what her brain was doing. So she looked like she had like kind of a big blister on the side of her head where you could see the scar from her surgery. So she had to go back to the hospital for like 3 months and get a shunt put in. And then that helps drain and regulate her spinal fluid. And then because of all of this, she had seizures. So we couldn't control the seizures with all the medications. So she also got a VNS put in her, which is basically kind of a pacemaker for the brain. It might sound horrible, but it shocks her every couple minutes or so to stop the brain from seizing. Being told that your little girl has brain cancer and was given a 10% chance to live, there's no words to prepare for that. You kind of got to search deep down in your soul, because I had to be one type of mom at the hospital and I had to be another type of mom at home. I still had 5 children at home that needed to be nourished and, laughed with and played with and know that everything's okay. And then I would go to the hospital and have this child that was almost lifeless at times, and the things that she had to go through, you never would dream in a million years that you'd see your child go through that.
I'm Melissa Babel. I am Presley's occupational therapist. I have known her since she was born, and I have seen her grow to what she is today. Well, Presley was born neurotypical. She went through cancer treatment, and she had surgery on a portion of her brain. So that has affected her motor abilities. And she had some significant setbacks after her surgery and her cancer treatment. She has come a long way from not being able to do really much of anything. Now she is beginning to stand on her own. She is beginning to crawl. She sings anything you can imagine, and she's just a little miracle. Absolutely. Presley has already come so far from when she had her diagnosis and her treatment. We have seen just miraculous improvements, and she has just the best attitude about life, which goes a long way. She's just a little bundle of sunshine, and so I think with the right therapies and interventions going forward, she has great potential to make a lot of progress.
I'm David Pickard. I'm a clinical supervisor for Dependable Nurses, Inc. in Phoenix. I do pediatric home care. I guess her medical history affects everything that we do because she requires, the feedings through her G-tube. She's not able to eat by mouth, and then she requires supervision, like medical supervision for respiratory and making sure she's safe at all times. It would depend as far as like Presley's case. If there was ever anything to, she was not in remission, we would still provide the same care, but it might change based on like what the doctor recommends if there's like a change in her condition. But just them not being in remission wouldn't necessarily change their services. But yeah, we would just change it based on what the doctor states they need.
You got it.